one more, and I'm going to butcher this. Cholesteatoma.
Really close.
Ooh.
But maybe cholesteatoma?
Yeah, like cholesterol had T with toma.
There you go.
Cholesteatoma.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
It's Monday, and that means it's another brand new episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Jordan Strong.
Thought only loud noises caused hearing loss? Well, then you're wrong. Okay, you're wrong. Spurred on by the article written by Dr. Madeline Henry of Link Audiology, today Dr. Jordan will be discussing what diseases, yes, diseases, can cause hearing loss. And so I think this might come as a shock for a lot of people, Dr. Jordan, where we just assumed, kind of hoped that it was just noises or our lifestyle that could cause hearing loss. And the article that we're going to talk about today, in fact, says, sure, those things can cause hearing loss too,
Sure.
But there are other quiet culprits that we can't actually foresee coming that could drastically affect our hearing as well.
For sure.
So, trying to take a high-level view here because we do not want to get into the true nuts and bolts of all of this stuff. Nobody needs an AUD degree after listening to this podcast. Talk to us about some of the diseases that may or may not affect someone's hearing.
I mean, yeah, this could go on for so long.
Yeah, people are going to appreciate it if we keep it to 10 minutes.
For sure they will. So to really kind of get into it, you kind of have to understand, I guess, kind of the main components of the ear in general.
Hit us with them.
So you have the outer part of the ear.
Got it.
Which is made up of the pinna and the ear canal.
Okay, so not the earlobe. We're going a little further.
Sure,
Okay.
earlobe included.
Got it.
Go for it.
Okay.
You have the middle part of the ear, which is where the eardrum starts. You have these three little bones or ossicles that are in there. They're teeny-tiny. They're actually the smallest bones in your body.
Dang it. I was going to try to show you my merit by saying those are the three smallest bones in the body. But you needed your moment.
You still take the credit. You still take the credit.
Appreciate it.
And then you have the inner part of the ear, which is called the cochlea. There are these tiny little hair cells that are in there.
Okay.
You also have the vestibular part or the balance part of the hearing mechanism, and then the brain.
Okay.
To kind of understand the diseases, you kind of have to understand that whole process and how that works.
Okay.
So from there...
Everybody get out your notepads because you're going to learn how it works now.
You're going to learn today. So if it's something that's happening at the outer or the middle ear, then that's what's called a conductive hearing loss.
Okay.
If it's something that's happening at the inner ear level or at the nerve or the brain, it's typically called a sensory neural hearing loss.
Okay.
Now you can also have a mix of both, and it's just called a mixed hearing loss.
Makes sense to me.
Makes sense. Yeah. So from there, we can have diseases of the outer, the middle, or the inner ear.
Sure.
So things like there's otosclerosis. Otosclerosis is where there's a problem with those three little bones that are going on. It's actually the tiniest of the three bones that's at the going in and out of the inner ear.
Okay.
There's kind of a little window there, and it goes in and out.
Like you can see it?
We can't see it, but it is happening. I mean, I guess you can see it with the imaging.
Okay.
But I can't see it by looking in.
But it's not like we're like waving through the window. Hey.
No.
Okay.
I mean, I guess your hair cells kind of are. But.
Hey, good to see you.
So then what happens is that what's called this stapes. So that tiny little bone, that stapes can get kind of fixed or stuck in that opening. Okay. And then it just gets stuck and it can't move. And that's how that sound has to travel. Our ear works as kind of like a chain reaction.
Sure.
It's got to go through the outer, the middle, the inner. And then if at any point something stops that, like the stapes, then it's going to affect our hearing.
How does one fix the stapes? Do you just hit the side of your head until it dislodges, or is that the layman's approach?
No, maybe not.
Okay.
So instead, we would recommend first you would go see your ear, nose, and throat doctor.
Okay.
They would determine if it's something that may be surgically be able to be fixed.
Got it.
Sometimes they can go in there and put in like it's a prosthesis where they can go in.
Like a little baby mini.
It is.
Wow.
It's tiny.
Wow.
It looks like a little horseshoe.
No way.
Yeah.
Cool.
They'll go in and put a titanium, I think it is, for the most part. They'll put that in there, replace it, or I guess the more common treatment for that is going to be a hearing aid.
Got it.
Yeah, where we can overcome that conductive component and increase that volume to get what you're missing.
Got it. So if someone's a little trepidatious about all things surgery related, the workaround would be a hearing aid. Got it. So then I have my article up here. Something like osteoporosis. I always assume from the many commercials that I've seen about osteoporosis that it would never affect your ears, let alone your hearing. So how does that even work?
Yeah. So, I mean, osteoporosis affects our bones.
Okay.
And those are 3 tiny little bones that are in our body.
Wow.
And just how osteoporosis can affect your arm, it can affect your ear. It's definitely something, as a matter of fact, it's the most common type of conductive hearing loss for adults.
Osteoporosis?
Is otosclerosis. But
Otosclerosis.
yes, osteoporosis of the ear, if you will.
Got it. So then also just educate me, because I see on this list it says multiple sclerosis. Clearly I've heard of multiple sclerosis. But like if you were to define it, like if I didn't know and you were to tell me, assuming I didn't know what multiple sclerosis was, what is multiple sclerosis?
I'm definitely not a physician.
Okay.
But multiple sclerosis can affect the nerves, the bones, and it kind of varies by person.
Got it.
But it can definitely affect our hearing for sure.
That was spot on, because it says it's a neurodegenerative disease that leads to breakdown in the myelin sheaths.
So it's the coating on the nerve.
Obviously. I mean, I knew that, but thank you for telling me that too. In addition to the nerve fibers themselves. So it's exactly what I thought it was.
Yeah.
100%.
Well, good job.
I
See?
knew it like I was in
this.
4th grade. And then something like meningitis. Again, tell me act like I don't know what meningitis is.
So meningitis is where it's going to attack. There's a kind of a viral component that can attack the brain.
Got it.
But because it's attacking the brain, it can also get to the ear.
Got it.
And at that point, when it attacks the ear, it almost like calcifies the inner ear to where the fluid that's naturally within the inner ear, it takes that part away. It kind of calcifies that.
Got it.
And it's got to be treated very quickly.
Got it. I'm sitting here and I know you're a doctor of audiology, and I'm like hyper impressed that you all know all this stuff. Like, I know that you were tested on all this. I know you went to school for this. And I'm sitting here being like, is Dr. Jordan the smartest person to ever exist?
Whoa.
I'm so thoroughly impressed. I have notes up here and I can barely understand what any of this is. And off the top of your head, and she's not even reading her notes. She has notes, but she's not reading them. She's like, this is what this is, and this is what this is, and this is how they negatively affect your body. And I'm like,
I mean, our patients ask us. They do.
Go figure.
I mean, you kind of have to be on it.
I'm just shocked that a doctor would have to know things about the body. Okay, here's another one. Now we're just on a roll.
All right.
Acoustic neuroma. What is acoustic neuroma?
So an acoustic neuroma is basically like these, they're pretty small in all reality. They're kind of, for lack of a better term, a small tumor that can happen on the auditory part of the nerve, or even
like baby.
Right. They're pretty small. Now they can grow, but they're typically slow growing. These are very slow growing tumors. They're benign. And from that, you can start to lose your hearing. You can have tinnitus. Those two are typically the first kind of signs that may be going on, and it's typically unilateral. Now, don't want people to panic. You can have unilateral tinnitus and not be a tiny tumor on your nerve.
Don't panic.
But it's definitely something that we're ruling out when we're looking at all of the test results and everything.
Got it.
But if that's happening, then for some people, they have it surgically removed.
Sure.
And then for other people, it may just be treated with a hearing aid. And we just kind of monitor it and see what happens.
Got it.
Yeah.
All right. One more, and I'm going to butcher this. Cholesteatoma.
Really close.
Ooh.
Cholesteatoma?
Yeah, like cholesterol had T with toma.
There you go.
Cholesteatoma. Obviously, again, I know what cholesteatoma is, but if I didn't, what would cholesteatoma be?
So a cholesteatoma happens in the middle ear space. And cholesteatoma is basically a buildup of keratin, which is skin cells. It's what our hair and skin and nails are made from.
Got it.
And it just kind of builds up and creates this little ball behind the eardrum that can just grow and grow and grow. And then it's going to push on all of those things, the eardrum, the bones, and it'll start to cause other problems, kind of erode at other things.
And is that surgery? We get rid of that with surgery?
Yeah.
Got it. Well, now that we've properly terrified everybody listening to this, but at least you have a better idea of hearing loss and everything that can affect it, feel free to head on over to askanaudiologist.com for all your audiology insights. Dr. Jordan, I play this a lot, but like, I know you're a doctor. I know you literally need to know these things. Blown away.
And it's, Kev, it's tough out here.
I don't doubt it. I can barely read and you remember all of this stuff. So good for you. So Dr. Jordan, thank you so much.
Absolutely. Happy to be here.
We'll see you guys next week.
You can find more information at askanaudiologist.com. And you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
We've had patients bring hearing aids in pieces that were chewed by a raccoon.
Okay.
Dogs, you know. We have repeat patients that come in and go, well, you didn't teach me how to clean my hearing aids.